Welcome to the Living Kidney Donation Education PowerPoint. My name is Andrea Brazao, and I'm one of the living donor nurses here at UCI, and I will be going over the first half of this education presentation with you. Why are you here today? So most importantly, you are here today to receive education on living donation so you can make an informed choice whether living donation is right for you. And of course, we're going to go over the risk associated with living donation in regards to what the medical, surgical, psychosocial, and financial risk are, the risk for your potential recipient, alternative treatments for your recipient, the SRTR outcomes, kidney paired exchange, learning the medical assessments and what's needed to minimize the risk to you as the donor, learning about our psychosocial evaluation, and the benefits of being a living donor. How is the living donor surgery performed? So the surgery to remove a kidney is called a nephrectomy, and there are two types of nephrectomies performed at our transplant center. The first one is our laparoscopic technique, and this procedure is the most common type of surgery performed when we do our nephrectomies. It is minimally invasive, and it usually provides the least amount of discomfort for our donor and provides smaller incisions. The second type of technique is called an open, and normally it is more invasive and involves a longer incision made under the ribs on the side and back. So if you take a look at this slide, we give an example of what the nephrectomy incision looks like for the laparoscopic procedure. So we have a male picture where you can see the vertical scar through the belly button, and then the female picture as well. So what is the living kidney donation informed consent? So this is a document that provides you with information about the living kidney donor evaluation process and surgery. This document will help you make the informed choice whether living donation is right for you. This PowerPoint is educating you today on living donation and the information that is provided in the living donor consent. You will have the opportunity to ask questions before agreeing to continue with living donation at the end of class. Continuing with the informed consent after education, we will need you to sign the informed consent for living donation. And we like to let you know this is not the actual consent for surgery. If you decide to continue with donation and you are approved as a donor, you will have additional consents that you will need to sign before surgery. What is withdrawing consent? So withdrawing consent means you have the right to stop your consent to donate anytime up to the day of surgery prior to induction of anesthesia. For any reason, if you decide not to donate, most importantly, the reasons for your decision will not be shared and the details are not shared with your potential recipient. So other consents that we will go over today in the later slides, we'll go over the HIV testing consent, the authorization to obtain your outside medical information, and then kidney paired donation consents if applicable. Confidentiality. Communication between you and the members of the transplant center remains private as required by law and hospital policy. And continuing with confidentiality is recipient confidentiality. We cannot disclose to the living donor certain information about candidates' health that may affect recipient transplant outcomes. So this information can include reasons for a transplant candidate's increased likelihood of adverse outcomes, or personal health information collected during the transplant candidate evaluation, which is confidential and protected under privacy law. So we always encourage the donor and recipient to communicate with each other to see where each other is at in the process, as we cannot give information to the recipient or the donor. Living donor team members. So who are the living donor team members you will be working with? You will be working with our living donor administrative coordinator who will help get you scheduled for all your testing. You will have your living donor nurse coordinator. You will meet your nephrologist, who is the kidney doctor, the living donor surgeon, and the Independent Living Donor Advocate, or what we abbreviate as ILDA. Those three providers you will meet in your clinic visit. You will also be working with a social worker, a dietitian, and a pharmacist throughout the evaluation process. Independent Living Donor Advocate, or what we call ILDA. So this person is not part of our transplant team. This person is a social worker that is part of UCI Hospital. So the ILDA is to help promote your best interests and advocates for your rights as a donor. They are available to assist you during your donation process. They ensure you have received education regarding the evaluation process, surgery, pre and post-op care. They ensure you understand the importance of post-donation follow-up, risk and benefits also of living kidney donation. And lastly, they ensure that you are willingly opting proceed with the living kidney donor evaluation. This consult, like I said, will be done in clinic and is done privately between you and the ILDA. So the kidney donor evaluation process, the evaluation process is very important because it does help to measure your appropriateness as a living donor. UCI, as a transplant hospital, will decide who is a candidate for transplant based on our own criteria, policy, and clinical decision. Of course, lastly, the detailed assessment is done to try to lessen the health risk to you. So continuing with the kidney donor evaluation process, your medical evaluation will consist of laboratory work, radiology diagnostic testing. We will screen for any evidence of kidney disease, infectious disease, and medical comorbidities that may increase your risk of renal disease. And also, our team may decide that additional testing is necessary to help make sure your physical and mental health and safety before and after living kidney donation are met. So our psychosocial evaluation is done by our transplant licensed clinical social worker. And this evaluation is to determine if there are any pre or post donation emotional concerns and to assess your decision making capacity. This is also to screen for any potential mental health issues and to evaluate for potential coercion. At the discretion of our licensed clinical social worker, donors may be required to complete a psychiatric consult, and all of our non-directed donors will need a psychiatric consult as well. And also, this consult is done via Zoom, and it is done privately between the donor and our social worker. Selection criteria. So at any time during the evaluation process, we may decide that you are not a candidate for living donation. So each transplant center has its own set criteria for selecting living donors. If we decide that you are not a candidate for living donation, you may qualify for donation at another center. Once you complete your living kidney donor evaluation, your case will be presented and reviewed in our selection committee, which is our entire transplant team, to help decide your candidacy. So benefits of living donation. So there is no direct or financial benefit to you having this surgery. We just ask that you're giving out of the goodness of your heart. It is a federal crime for you to receive payment or anything of value in exchange for donating your kidney. A possible secondary medical benefit of the donor evaluation is finding out about a health problem which you may have not been aware about before or which you may require treatment for. Mandatory donor follow-up. So our donors are seen for their post-op visit 1 week after their donation surgery date. And then after that, the hospital that you donate to, so here at UCI, we are required to report living donor follow-up information at 3 different times. So that's at your 6-month, 1-year, and 2-year anniversary after donation. The living donors must complete mandatory follow-up, and our staff will call to arrange this for you. And what this looks like is we try to make this as easy for our donors as possible. We will need you to complete labs either here at UCI or at a Quest local to you. We will have your vital signs checked at the same time. And then after that, you will have an MD consult via telemedicine. So our provider will just give you a call to review your labs and your vital signs. And just as a friendly reminder, as a donor, you are not billed for these follow-up visits, and you are also not billed for the evaluation process and surgery. So if you do receive any type of bills related to the donation, evaluation, or surgery or follow-up, please let your nurse coordinator know and we can go ahead and take a look at those bills for you. So benefits for your transplant recipient. So benefits for the recipient of a kidney donation generally include, of course, stopping or avoiding dialysis, which then has an improved health status, less time on the transplant waiting list, which could have a positive effect on the recipient's recovery after transplant, fewer side effects, and a longer life post-transplant. So now we discuss the risk for your transplant recipient. So while life without the need for dialysis is of course the goal for our kidney transplant patients, there are risks to the potential recipient as well, which can include 1, rejection of the transplanted kidney, 2, the disease recurrence, 3, thrombosis or blood clot, 4, infection, 5, death, and lastly, loss of insurance and the ability to cover the cost of medications needed to maintain the transplanted kidney. Your recipient will need to take their immunosuppression for the life of their transplanted kidney. Alternatives for potential recipients. So we have to discuss the alternative treatments for your potential transplant recipient are to wait on the OPTN wait list for a deceased donor kidney and to remain on dialysis. Risk of living a kidney donation. So now we will discuss the risk for you as a potential donor. So there are potential medical, surgical, psychosocial, and financial risk, which may be temporary or permanent associated with being a living kidney donor. So the potential risk associated with the evaluation process can include an allergic reaction to contrast or dye, discovery of a reportable infection or disease, discovery of serious medical conditions, discovery of adverse genetic findings previously unknown to you, or discovery of certain abnormalities that may require further testing at your expense. Potential medical risk for you as the living donor. So you will experience decreased kidney function of about 25 to 35%. You may have a higher risk of developing chronic kidney disease, potential for other medical complications, increased risk of complications with the use of over-the-counter medications and supplements, meaning that we advise all of our donors to avoid taking NSAIDs, which can include Motrin, Advil, ibuprofen. We ask that you do take Tylenol instead. And if you are not sure about a medication, you can always reach out to our team after donation. For a potential medical risk, there is a chance for death. Risk of preeclampsia or gestational hypertension is increased in pregnancies after donation. Also, the morbidity and mortality of the living donor may be impacted by age, obesity, hypertension, or other donor-specific pre-existing conditions. Potential surgical risk. So you will have the surgical scar, pain, fatigue, and other consequences typical of any surgical procedure. There could be abdominal or bowel symptoms such as bloating, nausea, or developing a bowel obstruction. There could be bleeding, uncontrollable bleeding, which may require blood transfusion or reoperation, a blood clot formation, pneumonia, nerve damage, a wound complication such as a hematoma or infection. So continuing with the potential surgical risk, there could be a chance for a hernia, decreased kidney function, acute kidney failure and the need for dialysis or kidney transplant in the post-op period. Female living donors, the risk of preeclampsia or gestational hypertension are increased in pregnancies after donation and death. So potential psychosocial risk for our potential donors. So there could be problems with body image, post-surgery depression or anxiety. Recipient outcomes may not be equal in a paired exchange. Feelings of emotional distress or grief if your transplant recipient experiences rejection, the recurrence of the disease, or an event of the transplant recipient's death. And lastly, impact of donation on your current lifestyle. So nutrition after donation, this includes a well-balanced diet, including low-fat protein, fresh fruits and veggies, fiber-rich breads, cereals, low-fat dairy, and heart-healthy fats. To avoid excessive protein intake in your diet by avoiding protein supplements and low-carb diets using protein as your primary food source. To stay active and avoid smoking. And this slide is just giving you an idea of what our dietitian recommends in having nutrition after donation, having a well-balanced plate of fruits, veggies, grains, protein, and dairy.
Hello, my name is Sheila Alcantara. I am the Other Living Donor Transplant Coordinator at UCI. I will be presenting the second half of our donor education. The Scientific Registry of Transplant Recipients, or SRTR, is transplant data pertaining to how well the UCI program performs, and this is reviewed every 6 months. You can access the most current SRTR at www.srtr.org. Kidney pair donation is also known as paired exchange. The Paired Exchange Program is an excellent program to help living donors assist their recipients in different ways. One is when living donors are incompatible, where they're not compatible to their intended recipient. Another is for non-directed donors. So those are donors who don't know anyone personally who needs a kidney, but they do want to donate their kidney to a stranger. Other donors who can participate in paired exchange are donors who want to help find a better matched donor, a better matched kidney for their recipient, or for different timing reasons that voucher donation or donating before their recipient is ready for a transplant. Those are also donors who can participate in paired exchange. And how does this work? The donor and recipient enter into the paired exchange program together as a pair, and then the pair can be matched with another incompatible pair or be part of a chain, which consists of several living donor and recipient pairs. You as a living donor and your intended recipient must agree to participate, and you both will receive additional education and consenting. This graph is showing how a donor, let's say that I want to donate to my mother, but my blood type is different from my mother's. So I am not able to donate directly. So if I'm donor 1, then I could donate to a stranger who's the same blood type, and then this stranger's donor donate to my mother. So this is just an example of the swap. More commonly than the swap from the previous slide is a kidney pair donation chain. This is when there are several centers involved. So for example, this would be a non-directed donor who is starting off a chain, and this person's kidney flies here, and then their donor's kidney flies to a different center. So these are different centers with several donors and recipients, participating in a paired exchange chain. UCI's transplant surgeons are Dr. Robert Redfield, who is our surgical director, and Dr. Hirohito Ichi. UCI's transplant nephrology team includes Dr. Udam Reddy, who is our medical director of the UCI Health Department of Nephrology, Dr. Ekamo Tantizatamo, and Dr. Anthony Ferre. Reminders about lab work and testing. For women, if you're on your menstrual cycle, do not provide a urine sample at this time. Just wait a few days until the last day of your cycle before giving a urine sample. So for clean catch urine, when you go to the lab, they may ask you to give a urine sample. So then the lab would provide you with a little cup and with a wipe. So how to do the clean catch method is for women, you would wipe from front to back. And for men and women, you would try very hard not to touch the inside of the cup as you open and close the cup. You would urinate into the toilet and then use your muscles to stop that urine flow. Bring the cup so that you can urinate into the cup to provide a sample. And then you'd close the cup. For fasting labs, do not eat or drink anything except water for up to 8 hours before the lab. Do please continue drinking water so that you stay hydrated. It's best to come early in the morning to do your lab work. The living donor coordinator or the assistant will tell you if you need to fast for your labs or not. And if you're not sure, just give us a call. We'll also let you know if you need to do a 2-hour glucose tolerance test. And if you do, for the 2-hour glucose tolerance test, you will fast for the 8 hours before your lab. The lab draws your blood, and then the lab gives you a sugary drink to drink. And 2 hours later, the lab draws this other blood test. And the point of doing this 2-hour glucose tolerance test is that we're looking for diabetes or prediabetes. Lab hours. UCI Health Lab is open Monday to Friday from 6:30 a.m. to 5 p.m. The latest time you can come to the lab for your blood to be drawn would be 4:30 p.m. And the lab is closed on some holidays. So 24-hour urine collection. This test is completed to check how well your kidneys are working. You will be provided with a container, a hat for females, and a lab form to perform this test. And the container actually can hold up to 3 liters. So if you feel like you need a second container, then please let us know or let the lab know so that you can get a second container. And on the container will be labeled your name, your date of birth, and your medical record number. The hat is this plastic thing that we would put for females only, that you would put under your toilet seat, and so that when you urinate, it captures the urine, and then you're able to pour the urine into the container. So you're going to plan to start the urine collection the day before you come to the lab for a lab draw. The 24-hour urine container needs to be refrigerated between collections and brought to the lab the same morning that you complete it. Some people also choose to put your 24-hour urine container on ice in a cooler in their bathroom. So if you do not bring the urine collection on the day you complete it, you're going to have to repeat the testing. And please remember, do not just drop off the urine, the 24-hour urine collection, without also having your blood drawn. Your blood draw is necessary for the lab to process your 24-hour urine collection. So if you're not staying to get your blood draw, then they're not able to process it and you may have to repeat the testing all over again. To review for the 24-hour urine collection instructions, when you first wake up and urinate in the morning, you do not collect that very first urination. You'll write the time and date on the lab form as a start time. Now, for every other collection, you're going to collect and pour the entire urine sample into the bottle given to you by the lab, and you're going to continue collecting and saving all the urine samples for the complete 24-hour period. You'll close the lid securely and gently mix or invert the bottle after each urine sample is added. Now, the very last sample will be the following day at the same time, the start time. And then you're going to write the time and date on the label, writing finish time. Now we will review some highlights from the presentation to test your knowledge. Number 1, a living kidney donor can be related or not related to their recipient. True or false? True. A donor does not have to be related to the person to be a match for kidney donation. And even if you're not a match, you can still donate through the Kidney Paired Exchange program. Number 2, can I change my mind not to donate any time during the evaluation process? Yes or no? Yes. At any time for any reason, you can choose to stop the evaluation process, and your decision will be kept private and confidential unless you would like to share that information with your intended recipient. Our program would strongly encourage that you at least inform your recipient if you're not moving forward so they could try to find another living donor. What are the benefits to being a kidney donor? A, the satisfaction of helping another person, or B, personal gain, monetary or other material items. The answer is A, the satisfaction of helping another person. In fact, it is a federal crime if you receive payment or anything of monetary value in exchange for donating your kidney. Who pays for the cost of kidney donation? A, my insurance, or B, my recipient's insurance? B, the recipient's insurance. Donors do not have to pay for the cost of kidney donation or the cost of the testing and appointments involved if this is done through UC Irvine. If you do receive a bill for tests or appointments done at UCI that are part of the donation testing, please let a team member know so we can have that bill corrected. What will I need to do to take care of my health after kidney donation? And choose all that apply. A, maintain a healthy lifestyle. B, maintain my pre-donation weight. C, have an annual checkup with my primary care physician. D, notify my OBGYN and my primary care physician if I ever become pregnant. And the answer is all of the above. Having a healthy lifestyle, including a healthy weight, and seeing your doctor for annual checkups is important for everyone. But it becomes even more important after kidney donation to make healthy choices. A living kidney donor should expect to be contacted by the transplant program regarding follow-up at 6 months, 1 year, and 2 years post-donation, and the donor should see their primary care physician annually after donation. True or false? True. Follow-up testing is mandatory, but does not replace your primary doctor or routine health care. Donors do not receive lifelong health insurance from kidney donation and should have their own health insurance. It is highly recommended that you have your own primary care physician to follow up annually and as needed. Consents will need to be returned prior to starting any testing or further appointments. The living kidney donation consent will be signed electronically by your nurse coordinator, indicating that you're providing verbal consent to proceed with living donor evaluation. If an in-person education class is completed, the living donor consent form will need to be signed immediately after class and returned prior to starting any tests or appointments. Authorization to obtain outside information is a consent where UC Irvine would be contacting your own physicians to obtain your medical records. For example, for a pap smear, mammogram, or colonoscopy report. Another reason the authorization to obtain outside information consent is needed is if the donor is participating in paired exchange. UCI requests that the donor also sign a consent allowing us to test for HIV. Please sign this form and return it. Please contact our program if you have any questions. You can email your transplant coordinator or assistant or call the transplant office at 714-456-8441. We really appreciate you. Thank you for listening to this donor education.